Dr. Uché Blackstock joins me now. She's a medical contributor for Yahoo News and an emergency medicine physician. Dr. Blackstock, welcome. Great to have you with us. We are, of course, still seeing such devastation across the country. How is life going to change in the U.S. over the next few months as more people get vaccinated?
Thank you so much for having me on. You know, we don't really have a significant number of vaccines yet to significantly see a change over the next few months. What we're actually going to see is an increase, unfortunately, in the number of deaths. By the end of January, it's predicted about 400,000 people. And so, you know, what we're going to need is for people to follow those public health measures that we know work so well. Masking, we know, could actually save almost 100,000 lives. We need people to continue to physically distance, and we also need state and local authorities to continue putting in restrictive measures to keep these infections rates down as much as possible. I think probably towards the spring we'll start seeing improvement in those numbers, but we still need folks to follow those prevention measures so that we don't see another exponential surge in cases.
And the FDA could approve the Moderna vaccine this week. How crucial is a second vaccine for slowing the spread of the virus? And is there any chatter in the medical community over whether one vaccine is perhaps better than the other?
Well, we already know that we don't have enough Pfizer doses, and that with Moderna, we'll probably have about another 150 million. And so, you know, that is going to be incredibly a key for the next few months. The difference is that we know is that, you know, the Pfizer vaccine showed some efficacy after the first dose, not so much with the Moderna vaccine. The Moderna vaccine, however, no one in the vaccine group developed severe disease, which is incredibly encouraging. Moderna also is approved for people 18 and older. Pfizer is for 16 and older, but both have shown significant efficacy as well as favorable safety profiles. And so they both are excellent candidates if people need to receive their first vaccine.
And are they both double dose vaccines?
Yes, they're both double dose. Pfizer is separated by 21 days and Moderna by 28 days. And it's really crucial that people go and get their second doses. We don't have enough evidence to know whether or not after the first dose, people have ample immunity. And so we really need there to be an excellent tracking system in place, and for there to also be public education and outreach about ensuring that people return for their second doses to make sure that they are fully vaccinated.
And once someone has taken that second dose, do we know how long the protection lasts?
So we don't know yet. We know that for the Pfizer trial that we had people being studied for up to 3 months, and they did retain immunity for up to 3 months. And this is why many of the clinical trial participants are going to continue to be studied for months after the emergency use authorization. We need to know whether or not how long the immunity lasts, but also whether people may still be infectious to others. And so because we don't have all that data yet, people will still need to wear masks, physically distance, at least for the short term.
And what specific issues, doctor, need to be addressed for minority communities to feel safe enough to get these vaccines?
Yeah, it's such an important question. What we're seeing is a significant amount of vaccine hesitancy, actually in a lot of different groups, specifically among Black Americans for just and valid reasons, given the history of medical experimentation and abuse in this country. And so I think what's going to be needed is an extensive public health outreach and messaging campaign that describes, you know, the vaccine development process. Transparency is going to be key, as well as engaging with trusted leaders in these communities, pastors, barbers. We really need to get everyone on board to understanding the importance of this vaccine, and then giving people the information so that they can make an informed choice about whether or not to take the vaccine.
All right, Dr. Uché Blackstock, thank you so much for sharing your medical expertise with us. We really appreciate it.
Thank you for having me.